Once the patient has been determined to be an acceptable transplant candidate and they're listed, one of the first decisions we make is whether we do a single lung transplant, which means one lung is removed and a lung is put in, or a double lung transplant or bilateral transplant, which means both lungs are removed and 2 new lungs are put in. And the surgeries are very different. If you have cystic fibrosis or significant pulmonary hypertension, most centers are going to recommend, or all centers will recommend, that you have a bilateral single lung transplant or a double lung transplant. Sometimes with the fibrotics, if the lung on the other side isn't affected, some programs might recommend a single lung, but for the vast majority of children, they're looking at having both lungs removed and new lungs put in. And so that operation requires either a clamshell incision, which is an incision that goes across the chest on either side, and it breaks the breastbone in the center. Some places are doing bilateral thoracotomies, which means there's a incision in the thorax on one side and then an incision in the thorax on the other side. But for children, since they're so small, the chest cavities are small, typically the clamshell is what incision we use. They are placed on cardiopulmonary bypass. This is a machine that was designed over 60 years ago to support the brain and the body while you operate on the heart and lungs. So they are put on the bypass machine. Both lungs are removed. If they have cystic fibrosis with a lot of infectious problems or a lot of infected sputum, we clean all of that out as best we can. And then the new lungs come in and the new lungs are sewn in. And I'd like to make it sound complicated, but it isn't. It's sewing 3 tubes to each other on each side. The bronchus gets sewed together, the pulmonary arteries get attached, and the pulmonary vein gets attached, and that gets done. So there are 3 large anastomoses that get created, and that happens on either side of the chest. And then the patient is closed and will come out with chest tubes in on either side. Chest tubes are silastic tubes that prevent any blood from collecting around the newly transplanted lungs.